Hey class, we're talking about the respiratory system next here. So primary purposes of the respiratory system, really key things, delivering the O2, but then also removing that CO2. Also within the respiratory system is that pulmonary ventilation. Really, I think that the biggest thing to actually get that O2 to the working tissue is going to be the overall breathing. Once again, pulmonary ventilation. Also, to actually get that oxygen to the working tissue, but also remove that CO2 is going to be that pulmonary diffusion. So we'll talk a little bit about just what's happening with that pulmonary diffusion, that exchange of O2 and CO2 between the lungs and the blood and really at the alveoli. And then that transport of O2 and CO2 via the blood. So actually getting that O2 to the working tissue. So once again, the vessel diameter, or the overall getting the O2 there and the CO2 out, but then also that diffusion at the capillary. So once again, at the muscle itself, to be able to diffuse that O2 and CO2, really the O2 getting to the working tissue, and then CO2 really to remove, and once again having that blood take that to the lungs, and so we can expire that CO2. Really the overall work of breathing really is somewhat passive, really, within that. We're not expending a lot of energy in regards to breathing. Now, definitely once we're exercising, more forceful, really is coming, most of the energy is coming from like the forceful expiration that we have during exercise, but really it's really pretty small oxygen cost and overall energy cost in general. So factors that kind of determine the energy requirements of breathing is really the overall compliance of lungs and the thorax itself. So definitely individuals that are maybe compromised in the lungs and really kind of that forceful expiration that they're kind of experiencing, any with emphysema or other things, even bronchitis, right? We have more energy utilized just for breathing at that point, right? So compliance of lungs and thorax are going to be the big impacts in regards to kind of overall oxygen costs and energy cost for actual breathing. Then also resistance of the airways to the smooth flow of air. Really, once again, when we're talking about bronchitis or other emphysema, that the overall resistance of airways, we're having to work harder for getting that oxygen to the working tissue. It's similar to what we talked about in regards to kind of the impacts that we see with left ventricle hypertrophy, right? We have kind of the athlete heart that's going to have that increase overall in the force of contraction due to just getting that blood to the rest of the body, versus a kind of diseased heart where we have left ventricle hypertrophy because it's working against resistance, has to work harder overall to get that blood to the working tissue. So with that resistance, the same thing with breathing, for fighting against and trying to work really hard to get that oxygen in and work to the working tissue. It's going to have more energy and more oxygen costs. So overall kind of pulmonary ventilation, like heart rate, we're going to see kind of that increase before exercise. So heart rate, we'll see this anticipatory response, even just kind of start to see that heart rate creep up going into exercise. The body knows what's happening. It's kind of a stress response even just before we start exercising. It's the same thing with ventilation as well. We're going to see our ventilatory rate increase, and we're going to take in more oxygen even before we start exercising. And then initially we're just going to see this rapid increase in the amount of ventilation that we have, right? Trying to get that oxygen to the working tissue. Now, definitely we talked about, anaerobic type work that we're going to do, where not necessarily we see a massive increase necessarily initially, but, we could almost hold our breath for the first kind of little bit of exercise, but after that we're going to have to really increase the overall pulmonary ventilation. So this is what I'm talking about in regards to that rapid onset and kind of that initial respiratory adjustment. But really that more gradual second phase of respiratory increase is kind of seeing at higher intensities, where it's kind of controlled primarily by changes in the chemical status of the arterial blood. So that kind of being able to respond to how much CO2 is being developed, the lactate response or the lactate increase that we have. Your blood is responding, and essentially your pulmonary system is responding to that. And then with that, helping to increase the pulmonary rate to actually help and get rid of that CO2 and get rid of that acidity. So with aerobic training, we can actually see decrease in ventilation during submaximal exercise. So essentially, you are not breathing as fast, but you're breathing more efficiently, similar to what we talked about with stroke volume, right? So we see that drop by 20 to 30%. So you're taking more breaths, or sorry, more volume within each breath. Okay, so more volume of air and getting more oxygen, essentially. Okay, so maximal pulmonary ventilation increases from around 100 to 120 liters per minute that we're bringing in, that overall volume of air, to 130 to 150 liters per minute in trained individuals. In elite endurance train, we could see 180 to around 200 liters per minute. So I just think it's unfair at that point. They're really taking in a lot of air and then definitely a lot of oxygen at that point. And then also we talked about kind of just that importance of that pulmonary diffusion, right? The unchanged at rest and during submaximal exercise, we're not seeing kind of, I'd say lower intensity submaximal exercise, but really at maximal pulmonary, or at least maximal efforts, kind of pulmonary diffusion increases. And so we're seeing kind of this increased preload, so more blood going to the lungs. And then we have that increase of perfusion. Really at rest, we're going to see perfusion really kind of on the lower half, and I would even say kind of the lower third of the lungs. So we're not having much perfusion overall in the lungs itself. But during exercise and during kind of higher intensity exercise, we increase that overall ventilation. We have 100% perfusion of the lungs, so more air brought into the lungs at that point, more blood and more diffusion happening at the lungs. So one of the biggest kind of, I'm going through several factors here that affect diffusion, but tissue surface area is one of the big ones. Once again, that overall, kind of you think of the capillaries, the overall kind of surface area that we have, more oxygen get through. Once again, more CO2 can be expired. Thickness of the tissue, so a little bit harder definitely if it's thicker to actually get the O2, and once again the CO2 out. The distance that actually has to travel. Diffusion coefficient of the gas, so once again each CO2 and O2 is going to have kind of a diffusion coefficient. And then also pressure gradient and partial pressure differences. We're going to see some differences in regards to that as well. And we're going to talk about that in regards to altitude. So kind of the last video that I have, we'll talk about altitude and the impacts that actually partial pressure of oxygen will have as we increase our overall altitude and how that impacts overall in performance. So definitely chronic adaptations we're going to see to aerobic exercise really do, some of the things we've talked about already, but respiratory adaptations, really we see ventilatory adaptations are really highly specific to activities, and really kind of the type of exercise we are training in. So specifically aerobic versus kind of anaerobic or strength training, we'll see adaptations to that. Definitely we're going to see, similar to what I said in regards to submaximal type impacts regarding to ventilatory rate, but even just the efficiency and how much oxygen we're actually getting to the working tissue. So aerobic versus anaerobic, definitely aerobic, we're going to see more oxygen getting to the working tissue, where anaerobic is really, once again, not seeing that aerobic type response or adaptations to exercise. So training adaptations really include kind of that increased overall tidal volume of breathing, the overall breathing frequency, and then just kind of with that maximal exercise. So the overall, how much oxygen we're getting in, and then the overall frequency, like we talked about, seeing that lower overall, just more efficient breathing, right? And getting more volume of air in at lower intensities. So overall, the Fick equation is one thing that we can actually look at and go through in regards to quantifying how much oxygen is actually being consumed. So essentially in this equation, if we're looking at VO2 equals this cardiac output, once again, how much blood per minute is being pumped around, and then we multiply that by the arterial is the A minus the veins. And so A VO2 difference, okay, so veins, and actually how much O2 is actually in the veins itself. So essentially with that, we can look at how much oxygen is in the arterioles getting to the muscle itself. And then we can also draw blood from the veins, and we could actually see how much oxygen was actually utilized in the muscles itself. It's a very nice way, and it's not extremely easy to do it. It's pretty invasive, but at the same time, we can look at the arterial oxygen content and then the veins, and we can actually quantify how much oxygen was actually consumed in the muscles itself. And then really from that, once again, VO2 is volume of O2 consumed by the muscles per minute, right? So with that, once again, we have arterial blood and then venous blood, and actually be able to quantify. Okay. So example of this, once again, we have, maybe in the artery, we have 20 milliliters of O2 per 100 milliliters of blood. The veins, and once again, this is at rest, so the veins, 14 milliliters of O2 per 100 meters. So we know at that point we have 6 milliliters of O2 per 100 milliliters of blood as an example, right? And then during exercise, we're going to see much different in regards to a much bigger response and have much more consumption of that oxygen in the working tissue. Okay. So one question definitely on an exam could be, what is that Fick equation? I'm not necessarily going to have you to solve the equation, but be able to explain it, right? The A, arterial, minus the venous O2 difference, right? And so I'll be able to explain that, okay? And kind of going along with the pulmonary system, I want to just talk through the altitude and just overall altitude in general and the impacts that it actually has on the pulmonary system and really overall in performance. So really in sports, high altitude typically means at least 7,000 to 8,000 feet above sea level, but really we can see impacts on performance even at lower altitude. So we'll actually on the next video, I'll actually talk through kind of exercise at altitude and the impacts that it has and kind of talking through that partial pressure of oxygen. So I'll see you on the next video here.